Today's topic is on common ways of dealing with menstrual pains. I am Dr. Asogwa Damian, you.Do, a consultant obstetrician and gynecologist at Asogwa University Teaching Hospital, Abakaliki. Menstrual pains, also regarded as dysmenorrhea, is a medical term for painful menstrual periods which are caused by uterine contractions. Primary dysmenorrhea refers to recurrent pains, while secondary dysmenorrhea results from reproductive system disorders, as in one with a coexisting gynecological disorder like uterine fibroid. It can also aggravate menstrual pains. Both of them can be treated. What are menstrual cramps? Dysmenorrhea is the medical term for pain with menstrual period or menstruation, also referred as menstrual cramps. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea is the name for common menstrual pains that come back over and over again. They are recurrent and are due to other diseases. Pain usually begins 1 or 2 days before you get your period or when bleeding actually starts. It's also called premenstrual pains. You may feel pain ranging from mild to severe in the lower abdomen, back, or thighs. Pain can typically last for 12 to 72 hours, and you might have other symptoms such as nausea and vomiting, fatigue, and even diarrhea. Common menstrual pains may become less painful as you get older and may stop entirely if you have a baby. What causes painful menstrual cramps? Menstrual cramps happen when a chemical called prostaglandins makes the uterus to contract, that is, to tighten up. The uterus, the muscular organ where a baby can contract throughout your menstrual period. Those contractions are actually what causes the menstrual pains that women experiences. During menstruation, the uterus contracts more strongly. If the uterus contracts too strongly, it can press against nearby blood vessels, cutting off the blood supply of the oxygen to the muscle tissues, also called cutting off the supply of oxygen to the muscle tissues. You feel pain when part of the muscle briefly loses its supply of oxygen. How does secondary dysmenorrhea cause menstrual pains? Menstrual pain from secondary dysmenorrhea is the result of problems with the reproductive organs. The causes could be endometriosis. Endometriosis is a condition in which the tissues lining the uterus, the endometrium, is found outside the uterus. Because these pieces of tissue bleed during your period, they can cause swelling, scarring, and also pain. Another related morbidity is adenomyosis, a condition where the lining of the uterus goes into the muscles of the uterus. This condition can cause the uterus to get much bigger than it should be, along with abnormal bleeding and pain. Pelvic inflammatory disease is an infection caused by bacteria and chlamydia that starts in the uterus and can spread to other reproductive organs. Pelvic inflammatory disease can cause pain in the stomach, can cause pain during sex, and then pain around the pelvis, which can be mild, ranging from mild to severe, can be short-term, can be chronic. Cervical stenosis, narrowing of the cervix or the opening of the uterus. And then finally fibroids, growth of the inside, or in the uterine walls, interferes with those contractions and aggravates pain during menstruation. Severe dysmenorrhea can cause vomiting associated with fever, diarrhea, dizziness, fainting, or even near fainting attacks. The rider looks like a sunburn in a life-threatening illness. Toxemia. How do we manage dysmenorrhea? Place a heating pad or hot water bottle on your lower back or abdomen. Rest when needed. You may need to rest. Avoid foods that contain caffeine, avoid smoking and drinking alcohol. Massage your lower abdomen and lower back. Regular exercise can equally help to lessen the menstrual pain. So to help prevent menstrual cramp, make exercise a part of your weekly routine. For severe dysmenorrhea, we use medications. Anti-inflammatory drugs like ibuprofen can be used with caution for those that have gastric ulcers. They reduce the output of prostaglandins. Other ones include oral contraceptive pills. There are some other suggestions which has not been really evidence-based. Yoga, massage, acupuncture and acupressure, relaxation of breathing exercises. These are some of the suggestions that people make. Yes, it may be useful for some people, for some group of people. It can also help in reducing menstrual pains. Can we actually prevent menstrual pains? Probably not, because it's a physiological function in females. And eating a balanced diet and getting regular exercise may help to reduce the cramps from being intense to that of the mild form. Conclusion: emotional stability, exercise and medication can reduce the extreme pain associated with painful menstruation. Thank you.